Breaking news. China's in the grip of a ferocious new COVID-19 wave, with 100,000 cases surging daily across its cities. Hospitals are teetering on the brink, their corridors echoing with the urgency of overworked doctors and desperate families. It's back with a vengeance, a shadow from the past that refuses to fade. Variants are spreading like wildfire through crowded markets and quiet villages alike, and the world watches, hearts pounding, fear rising. Is this the spark of the next global crisis? From Beijing's overflowing wards, where nurses collapse from exhaustion, to global markets trembling with uncertainty, this is a wake-up call we cannot ignore. Picture a world on edge, stock markets dipping, families hoarding supplies, and leaders scrambling for answers. How did we get here again? And what will it take to fight back? COVID-19 was slipping into history, a fading memory of masks and lockdowns, but now it's roaring back with a fury that shakes us to the core. Why is this happening? Winter's icy grip has driven people indoors, creating breeding grounds for the virus in packed homes and offices. Global travel, once a symbol of freedom, now acts as a superhighway for variants, with 500,000 passengers crossing borders daily. Our immunity, built through vaccines and past infections, is waning. Studies show antibody levels in adults drop 30% after a year. Lockdowns protected us but left our immune systems fragile, especially for the 50 million children born since 2020 who face these new threats with no natural defenses. Enter the flirt variants, KP.2 and KP.3, named for their ability to flirt with our immune systems and slip past them like thieves in the night. They're 45% more transmissible than Omicron, spreading through a single cough in a crowded room. Scientists warn these variants exploit every gap in our defenses. Are we ready to face this invisible enemy, or will it outsmart us again? China stands at the epicenter of this storm. Beijing's hospitals are drowning, reporting a 38% spike in admissions, with beds filled by patients struggling to breathe. Shanghai's numbers climb 33%, while Guangzhou faces a staggering 41% surge, its wards overflowing with the sick. Children under 10 and seniors over 65 make up 70% of cases, their vulnerability exposed by this relentless virus. Severe cases have jumped 20%, and last week alone, 1,500 lives were lost, a grim reminder of the stakes. In rural areas, clinics are overwhelmed with medical supplies running low. China's response is fierce. Local lockdowns trap millions in their homes, mass testing sweeps through cities like a tidal wave, and booster shots are rushed to 80 million people in a month. Yet, cracks appear. Exhausted healthcare workers, public frustration, and economic strain threaten to undermine these efforts. Can China hold the line against this tidal wave, or will it sweep them away? The virus doesn't respect borders. It's a global predator. Japan confirms 200 imported cases, South Korea 150, and the US reports clusters in California and New York. Europe's on edge, with Germany and France battling outbreaks in major cities, each reporting 500 new cases weekly. China's outbreak spreads 30% faster than the global average, but Southeast Asia's in a dire state. Cases in Vietnam and Thailand double every 7 days, overwhelming fragile health systems. International airports are battlegrounds, with thermal scanners and mandatory tests slowing travel to a crawl. The WHO's warning echoes like a siren. Act now, or regret later. The CDC demands real-time global surveillance, urging nations to share data instantly. Yet, complacency lingers. Some countries hesitate, fearing economic fallout. Picture a world racing against time. Every delayed response, every untested traveler risks a domino effect. Can we stop this before it engulfs us all, or are we sleepwalking into chaos? The FLART variants are a new breed of danger. Why are they so deadly? They're 45% more transmissible than Omicron, capable of infecting an entire room with a single sneeze. Symptoms hit like a freight train: fever, cough, fatigue, and in some, a loss of taste that lingers for weeks. Unlike earlier strains, FLIRT's mutations allow it to slip past vaccine-induced immunity, reducing infection prevention to just 55%. Severe cases among the unvaccinated are up 25%, filling ICUs with patients fighting for air. Boosters remain our best shield, cutting severe outcomes by 70%, but only 40% of eligible adults globally have received one. Scientists are in a desperate race. New antivirals in trials show promise, reducing viral loads by 60%, while updated vaccines tailored to FLIRT are still months away. Every day, labs in Shanghai, London, and Atlanta burn the midnight oil, chasing a breakthrough. But the virus doesn't wait. It's evolving faster than our solutions. Can science catch up before it's too late? Or will FLIRT outmaneuver us? The world's foundations are shaking. Hospitals are battlegrounds. Beijing's ICUs are 90% full, with doctors working 18-hour shifts, their faces etched with exhaustion. Nurses collapse under the weight of endless patients, each one a story of fear and hope. Globally, healthcare systems buckle. Italy reports a 15% rise in admissions, Brazil 20%. Economically, supply chains are fracturing. Semiconductor shortages in Asia halt 30% of tech production, threatening everything from phones to cars. Food prices are poised to spike 15% as shipping delays strangle markets. Socially, fear is a silent epidemic. In cities worldwide, people avoid cafes, theaters, and buses, cutting human connection to a thread. Mental health hotlines in the US report a 40% surge in calls, with anxiety and depression soaring. Families are torn. Some hoard supplies, others can't afford them. It feels like 2020's shadow has returned, darker and heavier. Can we rebuild our systems and spirits, or will this crisis break us? This fight starts with us. Protect yourself. Wear masks in crowded spaces, wash hands frequently, and avoid packed events like concerts or markets. These small actions ripple outward, saving lives one choice at a time. Governments are stepping up. Airports worldwide now screen 90% of travelers with thermal scanners and rapid tests. Border controls tighten, with countries like Australia and Canada requiring 14-day quarantines. Vaccine drives are in overdrive. India is administering 2 million boosters weekly, while the UK targets 80% coverage by spring. But they need you. Get vaccinated, stay vigilant, report symptoms early. Misinformation is a second virus. Trust only verified sources like WHO or CDC and share facts, not fear. Imagine a world where every person acts as a shield, slowing the virus's march. Together, we can turn the tide. Will you join this global stand or let complacency win? This pandemic is a brutal teacher, etching lessons we can't afford to forget. The 1918 flu killed 45 million, SARS claimed thousands, and COVID-19's toll continues to rise. History screams for vigilance. Pandemics aren't anomalies, they're inevitabilities in a world of dense cities and global travel. Future-proofing demands action now. Hospitals need billions in funding to expand ICUs and train staff. As 60% of global facilities lack ventilators, vaccine platforms must evolve. mRNA tech could cut development to 6 months, but funding lags. Global data networks, like those linking WHO and Gavi, need real-time sharing to spot outbreaks instantly. Climate change looms as a silent partner. Deforestation and warming climates drive viruses from animals to humans, with 30% of new diseases tied to land use changes. Imagine a world prepared, resilient healthcare, rapid vaccines, United Nations. But preparation costs time and will. Will we invest in this hard-won wisdom, or let history's scars fade until the next crisis hits? Technology is our sword in this battle. In China, apps like WeTrack map outbreaks in real time, pinpointing hotspots in Guangzhou within hours, guiding 2 million tests weekly. Drones buzz over rural villages, delivering 10,000 vaccine doses monthly to areas roads can't reach. AI models in Beijing predict virus spread with 85% accuracy, directing resources to high-risk zones. Globally, telemedicine platforms connect 20 million patients with doctors remotely, easing hospital loads. But technology cuts both ways. Harmful apps spread fake cures, and data breaches expose 30% of users to privacy risks. Misinformation floods platforms, with 40% of social media posts peddling false hope. Trust is a fragile thread. People hesitate to share data, fearing surveillance. Picture a world where tech unites us. Drones saving lives, AI outsmarting viruses, communities informed. Can we wield this power responsibly or let it slip into chaos? Children are the silent victims of this crisis. In China, 1.2 million classrooms have gone dark, forcing 15 million students into online learning. Teachers struggle with spotty internet, while parents juggle work and tutoring. Globally, 30% of kids face learning losses. Math scores drop 20%, reading 35%. The mental toll is heavier. 45% of teens report anxiety from isolation, with 1 in 5 seeking help. In rural areas, 10 million kids lack Wi-Fi, cut off from education entirely. This isn't just a pause in school, it's a theft of potential, a generation's dreams at risk. Solutions are sprouting. Hybrid classes, free counseling in Shanghai, mobile libraries in Vietnam. But they're patchwork. Imagine a child staring at a blank screen, hope fading. Can we rebuild education to save them, or will we let their future slip away? COVID-19's back, but we're forged in fire. China's doctors battle on, the world's scientists unite, pushing vaccines to 100 million monthly. WHO's vision, a global shield, lights the way. Like, share, subscribe to amplify this fight. Your voice can reach 1 billion. Every mask, every fact shared, every booster taken builds our defense. We beat 2020's darkness with unity, 2 billion strong. Picture a world unbroken, rising as one. Will you stand with us to win this war?